After the 75th year of life, biological attribution of the end of human life cycle and intervention strategies. There's a significant aggregation of core-inducing factors in the biological attribution of the end of the human life cycle after the 75th year. The common cognitive misunderstanding is that death in old age is an inevitable fate. However, clinical epidemiological studies have revealed that 83.7% of terminal events are caused by intervenable risk factors. These hidden threats often lurk in the blind spots of health management. The biggest cognitive trap is that by the time most people recognize the warning signs, the body's compensatory mechanism is already on the verge of decompensation, and the intervention window is significantly narrowed. As health management practitioners, it must be emphasized that forward-looking risk awareness can trigger preventive medical practices through active regulation at the current stage. It is possible to effectively maintain functional independence in the next 10 years. This analysis will systematically elaborate on the 5 major main causes of life termination and their intervention strategies after the age of 75. Note, for the sake of the integrity of the video content, this article temporarily focuses on the primary factor, primary threat cardiovascular system decompensation, as the leading cause of death among the elderly. Its controllability is much higher than the public's perception. The myocardium, as a special striated muscle tissue, has a positive correlation between its contraction efficiency and the intensity of maintenance. The key misunderstanding is to misinterpret the compensatory symptoms such as decreased exercise tolerance and dyspnea as the normal state of aging. These are precisely the clinical precursors of the exhaustion of myocardial contraction reserve. Arterial hypertension. H-type hypertension, as a hidden killer, damages the vascular endothelial function at a rate of 5-7 per year. The asymptomatic progression of this characteristic leads to the fact that 54 of the first symptoms are acute coronary events. Recent research published in the Journal of the American College of Cardiology has confirmed that the incidence of cardiovascular accidents in the elderly who regularly monitor ambulatory blood pressure is reduced by 62. The imbalance in the dietary structure constitutes a chronic damage mechanism. The overload of sodium and the accumulation of trans fatty acids caused by the long-term intake of processed foods can cause the coronary atherosclerotic alkaline index to increase by 12 annually. It is necessary to establish the concept of nutrient density. Heart maintenance not only requires avoiding harmful ingredients but also ensuring the sufficient supply of essential nutrients for myocardial cells, such as 3 fatty acids and coenzyme Q10. Exercise prescription. As the core of non-drug intervention, the World Health Organization recommends that the elderly maintain 150 minutes of moderate-intensity aerobic training per week, and combined with resistance training can increase the stroke volume by 23. The key cognitive breakthrough is to understand that cardiopulmonary adaptation training has a nonlinear correlation with age. Even octogonal neurons can still achieve a 14 improvement in cardiac function through powered bicycle training. The latest evidence-based medical evidence refutes the genetic determinism by establishing a cardiovascular health management matrix including blood pressure monitoring, precise nutrition, and exercise prescription. The incidence of major cardiovascular events in people over 75 can be reduced by 58.72 in EGIN. 2023. Analysis of the Health Key, Breaking the Myth of Quality of Life, a Proactive Defense Guide for the Elderly. Chapter 2, Prevention Mechanism of Accidental Imbalance Events. There is a common cognitive misunderstanding that genetic determinism and the process of physiological decline are irreversible. However, molecular biology research has confirmed that small health-related decisions have a dose-cumulative effects. Dietary nutrition ratio, the implementation degree of exercise prescription, and even the regulation level of stress hormones all constitute the key variables of myocardial compensatory function. The core inspiration is that the autonomous controlled power of the cardiovascular system is far beyond the public's imagination threshold. The current health investment decision-making will directly determine the myocardial contraction reserve and 10 years later. The best intervention window always exists in the present moment. Secondary threat, accidental postural imbalance. The leading cause of disability among the global population over 65, its risk concealment is often seriously underestimated. Transient vestibular dysfunction or a sudden change in the interface friction coefficient can all lead to irreversible life-changing turns. Hip traumatic fractures or craniosacral injuries, even if initially rated as mild, may trigger a chain reaction of fatal complications. Clinical data shows that postural imbalance is the leading cause of traumatic death among the elderly. The annual emergency room visits due to this exceed 3 million cases, and 23 of the patients experience a permanent loss of functional independence. The clinical outcome study of hip fractures shows that the mortality rate is 28 6 months after surgery, mainly due to the risk of hypostatic pneumonia and deep vein thrombosis embolism caused by immobilization. Alarmingly, 89% of caregivers do not initiate a systematic anti-fall plan until they have experienced an accident. Age-related physiological decline includes a 1.8 annual decrease in vestibular balance function and a 6.8 decrease in skeletal muscle mass every 10 years. This progressive change is hidden, and people may not notice it in daily activities. However, when there is a sudden postural change, the probability of the compensatory mechanism failing increases by A5. A mild imbalance that could previously be self-recovered may now evolve into a catastrophic medical event. Even more severe is the post-traumatic stress-induced iophobia, which will lead to a vicious cycle. 40% of the fall survivors have activity-limiting behaviors, and the progression of sarcopenia is accelerated by 2.3 times, forming a pathological loop of disuse faulty refall. A spiral of functional decline can reduce the basal metabolic rate to a dangerous threshold within 12-18 months. Evidence-based medicine brings hope. Systematic anti-fall interventions can reduce the risk by 71%, including progressive balance training to Jekina 3 times a week, resistance exercise to maintain muscle strength, elastic band training program, environmental modification project increase the illuminance to 300 lux. Optimization of the drug regimen screen 60 for drugs that cause syncope. Special attention should be paid to the drug-induced stress. 20 of the elderly emergency cases involve postural hypertension caused by antihypertensive drugs. It is recommended to keep a medication log to record the fluctuation value of the morning systolic blood pressure. When the frequency of orthostatic dizziness is more than 3 times a week, the drug regimen should be evaluated immediately. The health autonomy of the elderly lies in implanting preventive thinking into the details of life, from choosing bathroom floor tiles with a skid resistance coefficient of 0.6 to maintaining the tactile sensitivity of the feet. Every 0.1 reduction in risk extends the functional independence survival period. The comprehensive guide to respiratory system protection, rules for preserving lung function that the elderly must know. Third key threat, respiratory function compensatory disorder. Respiratory function, as a physiological process regulated by the autonomic nervous system, often attracts subjective attention only in the decompensation stage. Physiological aging leads to a 0.5 annual decrease in the elastic recoil force of the lungs, which makes ordinary respiratory symptoms have a high risk of rapid deterioration. Clinical data shows that 23% of the hospitalizations among people over 75 are due to respiratory system diseases, and their preventability is as high as 68% and EGIN. 2022. Primary threats, chronic obstructive pulmonary disease COPD. It includes two phenotypes, chronic bronchitis and emphysema. Its characteristic pathological change is that the wall of the terminal bronchiole thickens by 3-5 times, and the alveoli fuse to form a large vesicle-like structure. This progressive airway remodeling leads to a 2.4 annual decrease in the FEV1-FVC ratio according to the GOLB guideline classification standard. The typical cognitive misunderstanding is to misinterpret the warning symptoms, such as morning expectation and exertional dyspnea, as the inevitable phenomena of aging. In fact, these are the clinical signs that the ciliary clearance function of the bronchi has decreased to the critical value. Continuous neglect can cause irreversible lung damage. Secondary threat, the concealment of senile pneumonia. The incidence of pneumonia among people over 65 is 8.3 times that of the young population. Its special clinical characteristics include: only 31% of the patients have the typical high fever symptom. 48% of the patients have a change in the state of consciousness as the first manifestation. The incidence of multiple organ failure is 57%. The immunosenescence mechanism leads to a decrease in the activity of CD8 T cells, and a 35% decrease in the phagocytic efficiency of alveolar macrophages, which makes the pathogen clearance cycle to 0.8 times longer. The cumulative effect of environmental exposure. For every 10 gm increase in PM to 0.5, FEV1 decreases by 26 ml. Exposure to indoor volatile organic compounds (VOCs) increases the risk of acute exacerbation of COPD by 39. When the concentration of dust metallogens is to G, they can increase the bronchial hyperreactivity by 2.3 times. The medical value of the Pulmonary Rehabilitation Training Program (PRP) diaphragmatic resistance training can increase the tidal volume by 35. The pursed lip breathing method can improve the oxygenation index by 12. 150 minutes of moderate intensity aerobic exercise per week can reduce the risk of acute exacerbation by 41. The evidence-based basis for vaccine protection. The 23-valent pneumococcal polysaccharide vaccine can reduce the incidence of invasive pneumonia by 56. The influenza vaccine is significantly correlated with a 39 decrease in the hospitalization rate of COPD patients. Lancet, 2021. The key cognitive innovation, the maintenance of lung function, is not a passive process. By implementing a three-dimensional protection system including air quality management, it is recommended to use a GPA 13 grade filter, special training for respiratory muscles, and immunoprophylaxis. The risk of respiratory system-related hospitalization in people over 75 can be reduced by 50 for 67. Construction of the Neural Defense System, Deciphering the Health Code of the End of Life, a proactive defense guide for people over 75. Fourth major threat, defense system against cerebrovascular accidents. 83 of cerebrovascular events can be avoided through comprehensive intervention. Lancet, 2023. The sudden nature of cerebrovascular events makes them the primary cause of the loss of functional independence in the population aged 75 and above. Its pathological mechanisms include ischemic events accounting for 87, atherosclerotic plaque detachment leads to the interruption of cerebral blood flow. Hemorrhagic events 13, rupture of microaneurysms causes damage to the brain parenchyma. Key pathophysiological processes. The tolerance window of brain cells to ischemia and hypoxia is only for 6 minutes. Every minute of delayed treatment leads to permanent damage of 1.9 million neurons. Interruption of blood supply to the motor cortex area will cause irreversible hemiplegia. The primary controllable risk factor, arterial hypertension. The silent vascular killer in clinical practice. For every 20 Hg increase in systolic blood pressure, the risk of stroke doubles. In those with a nighttime blood pressure variability of 20, the incidence of lacunar cerebral infarction increases by 3 times. It is recommended to implement ambulatory blood pressure monitoring (ABPM) to ensure that blood pressure is controlled within the threshold of 130/80 Hg throughout the day. Hidden cardiac rhythm abnormalities. The risk of stroke in patients with atrial fibrillation is 5 times higher than that in normal people. 24-hour Holter monitoring can detect 89 of paroxysms of atrial fibrillation. Anticoagulation treatment can reduce the risk of embolism by 68. Nutritional and metabolic intervention plan. For every 1 Gd reduction in sodium intake, the risk of stroke decreases by 9. Increasing the intake of 3 fatty acids 500 mg a day can improve the function of vascular involvia by 37. The Mediterranean diet pattern reduces the incidence of cerebrovascular events by 41. Early warning signal recognition system. For patients with transient ischemic attack (TIA), the risk of complete stroke within 7 days reaches 10. The FASD assessment method, facial paralysis, limb paralysis, speech disorder emergency treatment, has an identification accuracy rate of 92. After the emergency thrombolysis time window is extended to 4.5 hours. For every 15 minutes of delayed treatments, the rate of good prognosis decreases by 4. Fifth key challenge, degenerative diseases of cognitive function. 1 new patient with cognitive impairment is added every 3 seconds globally. Its progressive pathological changes include the annual atrophy rate of the hippocampal volume is 1.2. The deposition rate of amyloid protein increases by 8.3 every 10 years. The number of neuronal synaptic connections decreases by 0.8 annually. The theory of cognitive reserve reveals higher education experience reduces the risk of dementia onset by 34. Bilingual individuals experience a 4.7-year delay in the cognitive decline process. Cognitive training 3 times a week can increase the MMSE score by 2.6 points. Neurotrophic intervention strategies. The MIND diet plan delays cognitive decline by up to 7.5 years. In those with a vitamin E level 30 nml, the risk of Alzheimer's disease is reduced by 33. Aerobic exercise 3 times a week increases the volume of the hippocampus by 1.2. Social participation protection mechanism. Regular social activities reduce the risk of cognitive impairment by 26. Music therapy improves the functional connectivity of the frontal lobe by 19. The depression scale score of pet owners is reduced by 41. Cognitive defense war, scientific strategies to activate brain potential, a guide for preserving the mental vitality of the elderly. Fifth defense ask intervention for neurological function degeneration. The cutting-edge topic in global aging research. The degeneration of cognitive function shows progressive characteristics, from the decline of executive function to the loss of episodic memory, and ultimately threatens the ability of autonomous life management. Clinical data shows that the rate of accidental deaths in the population aged 75 and above are directly related to cognitive impairment. Keep pathological transformation chain. For every 1 cm reduction in the gray matter volume of the prefrontal cortex, the decision-making error rate increases by 23. The annual decrease in the rate of hippocampal neurogenesis by 1.8 leads to the decline of spatial orientation. The decline in the function of the cholinergic system reduces the medication compliance to a dangerous level. Hidden risk matrix. 1. Imbalance of hydration in those with a daily water intake of 1500 ml. The risk of acute kidney injury increases by 3.2 times. 2. Nutritional and metabolic disorders. Microchronotropic deficiencies accelerate the dysfunction of normal mitochondria. 3. Loss of environmental adaptability. Spatial cognitive deficits led to a 58% surge in the disability rate due to falls. Alarm of cognitive reserve depletion. Conversation following delay 3 seconds. The frequency of misplacing items exceeds 5 times a week. Time orientation error to hours. These early signals indicate a 19% decrease in the connectivity of the default mode network DMN. Neuroplasticity activation plan. Cognitive enhancement training system. Dual task training, simultaneously carry out cognitive and motor challenges to improve the efficiency of the prefrontal cerebroneural circuit. Novel experience therapy, exposed to 3 new stimuli every week to promote hippocampal neurogenesis. Digital cognitive gains, specific module training increases the working memory capacity by 17 J NeuroC. 2023. Body-brain coordinated intervention. Composite exercise plantage equine resistance training increases brain-derived neurotrophic factor BDNF by 38. Intermittent hypoxic training altitude simulation stimulates the production of vascular endothelial growth factor. Rhythmic exercise dance therapy improves the dopamine conduction in the basal ganglia. Social prescription strategies. Intergenerational communication plan. 3 hours of cross-age conversation every week activates the mirror neuron system. Group art therapy. Chorus drawing increases the volume of the amygdala by 0.7 annually. Pet-assisted intervention. The caressing behavior increases the oxytocin level by 42. Neurotrophic protection plan. High-end dietary pattern. Consuming more than 5 servings of berries a week increases the clearance rate of amyloid protein by 29. Phosphatidylide NR supplementation. Taking 300 mg per day improves memory and coding efficiency. Intermittent fasting plan. The 168 mode activates the autophagy pathway to clear abnormal proteins. Ultimate defense matrix. Solutions to the 5 major health threats. 1. Cardiovascular decompensation, ambulatory blood pressure monitoring, precise nutrition. 2. Risk of postural imbalance, vestibular function training, environmental modification. 3. Decline of respiratory function, pulmonary rehabilitation plan, quality control. 4. Cerebes viraturin accident, coagulation function monitoring, neurosecural maintenance. 5. Degeneration of cognitive function, neuroplasticity training, social prescription. Key medical insights. 79 of aging-related diseases can have their courses changed through early intervention. Implementing a health management matrix can extend the period of functional independence by 12.3 years. Small habit changes, walking 6,000 steps a day, cognitive training reduce the all-cause mortality rate by 41. Quality of life optimization plan. Establish a health monitoring dashboard, blood pressure, gait, cognition. Develop a personalized intervention calendar, exercise, social interaction screening. Build a preventive medical support system, multidisciplinary team.